Today's topic: when a candidate is very suitable to have Belotero either Revive or Belotero Volume inserted into their face, and when very occasionally, whilst you are a suitable candidate, we may need to say no. Yes, you're suitable, the timing isn't great. So that's the topic of today's coffee talk. So full screening is done with all of our clients. A information pack is emailed out to them, and the day or two before the treatment, a preparation for your treatment is emailed in advance to make sure that you fit all the criteria, that you've read all the information, and that you are deemed safe to have the work done. So when you come to us to have your work done, either come for a consultation or you're coming to have the work done anyway, we will discuss with you what your perceived problem is and what you would like to improve. So it's not a matter of just sort of tweaking here, and here. Sometimes, most of the time, we have to look at the overall reason as to why those issues are a problem and what we can do to resolve it. So it's not a matter of putting in filler to like a band-aid. We have to look at what's caused. So whilst having hyaluronic acid injectables done is a lunchtime treatment, there are a few side effects that are quite irritatingly minor, but you need to know about them in advance. The timing has to be right. You need to know that the work will start to, the injectables, it will start to work right away, but it'll take 1 full month for it to settle into the interstitial cells in your skin. It peaks at 2 weeks, so you'll find that the settling in period of the hyaluronic acid filler is 2 to 4 weeks. Therefore, if you have a special event like a red carpet event or a wedding, you do not want your hyaluronic acid to be still doing its work. You want it to be settled in where it's supposed to be. And if you got a bruise, that it has time to actually settle down. Side effect of this work is bruising. Number 1. So let's talk about bruising. So bear in mind, we have created an injury to your face. With Belotero Revive, which is the injectable that we do in little blebs all along your face here to give you that lovely moisturization from within, that is literally goes in at a 10-degree angle into your skin, and that causes little bumps which usually sort of peak at about 24 hours. And they flatten then as time goes on, usually after the 24 hours. And it is doing its work in attracting the water. So therefore you might find that you have the little bumps, even though they're flat, nobody really notices them, you know that they're there. And that will take 2 weeks to a month to actually settle into the interstitial cells. So that is the most superficial treatment that we have here. So we're still talking about bruising and the minor side effects that you can get with hyaluronic acid filler. Belotero Volume is the hyaluronic acid, which is a thicker consistency to Belotero Revive, and it is used usually for the nasolabial folds, the marionette lines, and cheek filler to give you more volume and to give you more scaffolding so that it actually raises your cheek off this fold here. This is the hyaluronic acid that is used for those areas. It's a thicker consistency than Belotero Revive, and it goes a little deeper than Belotero Revive. So when it's actually injected into this area here, you're at a greater risk of having a bruise. And I usually say to my clients, you will definitely bruise here, so you need to plan for it. And 68% of patients are likely to bruise. So bruising is a factor and not good luck. If you've got a red carpet event or something special like a communion or a wedding, you would have to camouflage that bruise. And as bruising is very minor, some people will bruise very small, but there are other people who have skin like a peach and they will bruise more. And bruising is the body's response to any trauma. If you hit a blood vessel while you're doing the work and the skin is broken during the injection, obviously we need to get under the skin. The blood and other materials inside the blood vessels, they leak out and they create that bruise. And what if you got a bruise on either side? And you can camouflage it with concealer for sure. But if you've got a red carpet event and a photographer is taking your photographs, they are so professional, but sometimes if it's at a wrong angle, you can have that bruise could be visible, and not a good look if those photographs are on the wall. Number 2, swelling. So it's another common minor side effect, swelling of the area. Yes, it is an injection. You've even seen it when you've had your vaccinations for COVID recently. The area swells, and swelling can be either a very minor complication, or you could be one of those people that it would actually swell more than most, and that will take some time to alleviate and to come down. It's a very temporary side effect, but if you have something happening, you don't want that to be on a photograph, and you want to be able to feel confident and at your best when you're having the photographs taken, knowing that the hyaluronic acid filler that you've had has been given ample time to settle and do its job. So as soon as the injection is done, it attracts 1,000 times its weight in water. So if you had hyaluronic acid filler, say for example here, it will attract 1,000 times its weight in water. So if you have had a 0.5 ml of hyaluronic acid filler here, in the first 2 weeks, that is actually going to attract 1,000 times its weight in water. So it will be perceived as being swelling, but it actually is doing its job in attracting the water to the area, but it needs 1 full month to actually settle properly into that area. So bruising and swelling are minor side effects and are a reason for no concern normally. So if you know that this is the way the pattern is actually going to go, you don't want to have it done 2 to 2.5 weeks before an event, when it needs a full month to settle into the area, particularly for the likes of Belotero volume, whereby it's a thicker consistency and it's doing its job in more scaffolding to soften these nasolabial lines, but they need a month. Number 3, flying on an aircraft after you've had hyaluronic acid filler attended to. Minor changes happen in the environment on flights, particularly flights of 3 hours or more. It can lead to side effects of the hyaluronic acid filler that you wouldn't normally experience. So the skin and the filler area is very vulnerable for the first 48 to 72 hours after the procedure. It's also very sensitive. And this is why we recommend that you do not fly 2 to 2.5 weeks after Belotero volume, and probably 3 to 7 days after Belotero Revive, because this is a lighter consistency. So whilst air travel doesn't create any new side effects for you or your skin, it increases the likelihood of developing the side effects which have already developed. So, in other words, if you already have swelling and if you already have some bruising, this, because of the pressurized air in the cabin on flying, it will actually increase the swelling, and it could prolong the bruising. Now, I know you can argue that air stewards and pilots flying all the time have their injectables and they fly that evening. They have been told the same thing. So we can only advise you, and this is not to be mean, it is actually for your safety. So everybody who's had injectables done are advised the same thing. We are not the hyaluronic acid injectable police to watch to make sure that what we ask of you is not done. So on your own head be it really, if it so happens that you choose to ignore the advice that we as professionals have given you. Number 4, after you've had hyaluronic acid injectables done, you have got direct access to us should anything go wrong. When a injectable is attended to, there is no guarantee that one of the side effects is not going to go wrong, and you do not want to be in another country if that happens, and you need to have access and be in the same country as us for the first 2 to 2.5 weeks should anything go wrong. You don't want to be overseas and a side effect or a complication of the work that we have done has materialized. You have no access to us, we have no access to you, and you attend a doctor overseas, and They're probably not in a position to be able to dissolve what we have injected, and there is a lot of panic stations. Why would you put yourself under that difficulty? One of the very rare and possible side effects that we have to tell all of our clients when they have hyaluronic acid inserted into their face, particularly if they're having cheek filler up here, is that whilst we do it in safety, there is a risk of, a very, very minor risk of blindness. Do you want that to happen to you when you are overseas? Absolutely not. So part and parcel of the consent form that you sign when you have hyaluronic acid, either Belotero Volume or Belotero Revive, is that you are aware of that possible risk. So don't choose to go overseas within a day or so of having your injectable done. What if you actually went blind? Now, it is so rare, but it is a possibility. So this information is not there to scare you. This information is there to highlight the reason why very occasionally we would say, no, yes, you're a suitable candidate, but the timing isn't great. And with all dermal fillers, there is a risk of bruising and swelling. And an aeroplane, the pressurization inside the cabin, it increases these risks. And as a general rule, we would say to you, wait 2 to 2.5 weeks after a dermal filler to let it settle into your skin and allow the post-treatment sensitivity and bruising and swelling subside. And then you can go and have your amazing holiday and your amazing wedding and your amazing red carpet event, safe in the knowledge that you've done everything that you've done. The work and hyaluronic acid has done its work. It's settled into the interstitial cells and you are glowing. Does that help?